Well, let's face it, we're all getting older, whether we like it or not. And this morning, we're focusing on aging eyes and how to care for them. Dr. Susan Quick is with the St. Paul Eye Clinic. Doctor, thank you for being here. And
thank you for having me.
I asked if it was fair to say that this is an epidemic, and you said yes.
Yes, you know, there will be 3 million white Americans by the year 2010 with severe macular degeneration.
Okay, before we go any further, let's define this. What are we talking about?
Well, first of all, the macula is the most important part of the retina. It's the central part of the retina, and it is in charge of the fine or detailed vision. If you get any deposits or blood in that area, then that's macular degeneration.
Okay, so tell me about someone at home, if they're starting to feel different, it doesn't look quite right. What are the symptoms that someone is going to be experiencing if they're getting this?
Well, the tricky part is you may not have any symptoms at first. And so regular eye exams with your IMD are very, very key. But you may have blurry vision, you may have gray or blurry spots within your vision, or you may have distorted vision.
Okay, so if someone comes in with those symptoms, you're going to do tests, and you've brought some slides to show us what you're looking for on a patient who might be suffering from this, and then what can be done. So why don't we run through those slides? What's this first one here?
That's a normal macula. I wanted to show you the nice pink macula right there in the center, and the optic nerve is there over on the side. If we go on to the next one, then I can show you an abnormal macula. And you can very obviously see those white and yellow dots.
Like cloudy spots.
Yeah, we call those drusen, and those are the deposits that form in the macula and can start to disrupt your vision.
Okay. The next slide here, what are we seeing?
So there I mentioned if blood or fluid gets in the macula, you can very obviously see that ring of blood, and that is very disruptive, and that's the wet macular degeneration.
Okay. And this last one here?
Yeah, I wanted to show you what happens with the treatments we have for wet macular degeneration. The blood and the fluid are gone, but sometimes you can be left with a little bit of a scar.
Okay.
And I believe there's one more slide. And that's our newer forms of treatment. You can see there's a little bit less of a scar, and very exciting, these newer treatments. We're seeing much better results.
Okay. Now, this is what would happen if you went into the doctor. There is something you can do at home. It's this grid that we have right here. Can you explain how that works?
This grid, we call it an Amsler grid, and it's just a crisscross grid, and the best way to look at it is right at the center where the dot is, and you look at it with one eye at a time using your reading glasses, and if you see any gray or blurry areas on there or anything missing or distorted, you're to let your eye doctor know right away.
Okay, and you give these out. We're going to give a number at the end of this interview, and if people call the number, they'll be able to get one of these.
Yes, we're happy to send anyone a free Amsler grid. You just have to call in.
Okay, and as with anything, it's all about prevention. So tell me about someone who's getting up in age. When should you start to worry about this? Is there an age where people start to experience it?
Yes, officially you have to be 45 or older in order to have macular degeneration. However, the older you get, the more likely you are to develop macular degeneration.
Okay.
And how to prevent it? First of all, regular eye exams are key. And as you get older, those should be yearly. And certainly if you have any changes, you should come in. But other key things you should do, you should stop smoking. There's so many reasons to stop smoking, and now we have another one. Exactly. So please stop smoking. You should watch your diet, watch your blood pressure. Oh, we do have lots of diet ideas here.
Yeah.
I wanted to show you carrots. We've always said carrots are good for your vision, and here they are again. They're good to prevent macular degeneration. We do know that omega-3 fatty acids can also help prevent macular degeneration. So we have some fish here, and also the almonds. And then we know that antioxidant vitamins are quite good for you.
Yeah, we saw that on the screen.
Yep, and there have been some studies to show that high doses can be very helpful.
And we should say, too, great technology available for someone that does find out that that they have this. You have magnifying glasses here. There's
magnifiers.
This one here is electronic. So if someone goes out to a restaurant, you can turn this on, you can put it on the menu, and you can see everything printed larger. So even if you have this, there are ways to make your life easier.
Right. We never say there's nothing we can do for you.
Well, doctor, thank you so much. Great information.
Thank you very much.
Really appreciate it. Don't forget to get that eye exam. For more information, if you'd like one of these grids, call this number. The St. Paul Eye Clinic can be reached at 651-738-6500, or, of course, you can visit KARE11.com. We've set up a direct link to their website on the Saturday show page.